All right. Good afternoon, everyone, and thank you for joining us at the California Dialogue on Cancer's Surveillance Data Webinar Series. My name is Sheila Sanyo Gerhardt. I go by she, her pronouns, Strategic Alignment Specialist for the Comp Cancer Program and the California Cancer Registry. Please feel free to introduce yourselves in the chat with your name, pronouns, and organization, and where you are joining from. So I'll go over some housekeeping while everyone is still typing in their intros. I also want to acknowledge my colleague Joyce Seha for our coordination specialist who is playing a key role in today's webinar's production. All participants have been muted, but we will leave the chat for any Q&A and any questions. We'll also have an allotted Q&A after the speaker's presentation, but please stay until the end of the presentation to participate in a short webinar evaluation. Again, for those who are just joining us, please type in the chat your name, pronouns, organization, and where you are joining from. The California's Comprehensive Cancer Control Program is a CDC-funded program that provides leadership and coordination of statewide comprehensive cancer control efforts. The Comp Cancer Program leads the Cancer Control Coalition, which is CDOC, or California Dialogue on Cancer, and is also required to develop and implement a state cancer plan. So there have been 5 iterations of the state cancer plan, including the 2026-2035 iteration, which is California's first 10-year state cancer plan. The plan focuses on health equity and prevention to eliminate disparities and improve outcomes. It is currently in the CDPH approval process, and then the plan will be available exclusively online. As a background information, these are the cancer plan topic areas for the upcoming 10-year plan. CDOC works closely with the California Cancer Registry and other partners to implement strategies from the surveillance topic areas. So our goal is to enhance cancer surveillance systems so we can produce and share data in ways that are meaningful and accessible to the public, health organizations, researchers, and other partners. CCR have supported key strategies such as ensuring wider dissemination of cancer data by producing culturally and linguistically appropriate cancer reports. In today's surveillance data webinar, a CCR researcher will present an innovative CCR interactive web application designed to display late-stage screen-preventable cancers at the county level. This tool, developed using ArcGIS spatial software, aims to assist county health jurisdictions in targeting areas for enhanced screening of colorectal, breast, cervical, oral, prostate, and potentially lung cancers. Next slide. Today's presenter, Vanessa Miguelino-Keasling, is a staff research scientist for the California Department of Public Health, Chronic Disease Surveillance and Research Branch. She has served as a research scientist for CDPH for over 25 years. She holds a Master of Public Health degree in Epidemiology and Biostatistics from California State University, San Diego, and a Bachelor of Arts degree in Psychology from University of California, Berkeley. Over the past decade, her work has included projects involved with the surveillance and research of cancer disease for the CCR, as well as studying BRFIS survey outcomes related to chronic disease risk and prevention practices, once serving as the BRFSS coordinator for California. In her spare time, she enjoys cooking, home winemaking with her husband, and spending time with her Great Dane. Please welcome Vanessa.
Hey everyone, thanks for joining on your lunch hour. I hope this presentation will prove to be helpful to you all. Thank you for the introduction, Sheila. Without further ado, I'll just get started and share my screen. And I'm going to turn off my video so that way we don't lose connection here. Yeah. Can everyone see the slides okay?
Yes.
Okay, so today I'm just going to talk about a web application that I developed. This one specifically on late-stage diagnosed colorectal cancers and sociodemographic disparities using data from CCR 2016 to 2022. So today I'm just going to go over, before I demonstrate the actual web application, I'm going to give you a little bit of background, the objectives, the methods for this web application, and some of the highlights, and then a short conclusion. So as most of you may know, the California Cancer Registry was established by state law in 1985. The CCR has collected information on all new cancer cases and deaths for the entire state of California since 1988. And hospitals and physicians are required to report cancer cases to the CCR. And to date, the CCR database contains over 6 million cancer cases, with nearly 200,000 cancer cases added annually. So just some basic statistics. Colorectal cancer still remains the second most diagnosed cancer and the second leading cause of cancer death among males and females combined in California. And while CRC, or colorectal cancer incidence and mortality rates, have declined overall since 1988, 37% decline overall for incidence and 36% decline overall in mortality, there still remains disparities by race, age, and in this analysis by county. If caught in the early stages, colorectal cancer has a 5-year survival rate of about 92%, and if detected at late stage, at 54%. And then as far as screening, in 2024, the most recent data that we analyzed from BRFSS showed that 65% of adults aged 45 to 75 years had met at least one of the United States Preventive Task Force recommended CRC screening tests. So on this graph, as I mentioned in the last slide, despite the overall decline in colorectal cancer incidence, overall trends among colorectal cancer cases ages 50 and older versus those diagnosed at early onset or less than 50 years old differ wildly. While not shown on the figures themselves, the age-adjusted incidence trends among persons diagnosed with early onset colorectal cancer are increasing by approximately 2% annually and indicate a disproportionate increase among American Indian and Alaska Native and Hispanic people, approximately annual percent change of 5.2% for American Indian and Alaska Native and 3.2% for Hispanics. Also, between 2019 and 2023, just recently analyzed data available, 62% of early onset cases, or those under age 50, compared to 62% compared to 55% among persons 50 years and older were diagnosed at late stage. So some of the objectives for this analysis and this project, the main objectives were to assist county health jurisdictions and public health cancer surveillance partners to navigate and utilize an interactive web application, to visualize and analyze late-stage diagnosed screen preventable cancers at the county level, to identify and compare the incidence rate and percentage of late-stage diagnosed screen preventable cancers statewide, and to characterize sociodemographic disparities, cancer screening prevalence, and risk behaviors for disease to enable to target areas for enhanced screening. So the methods used in this analysis, we included adults ages 45 years and older using 2016 to 2022 data from the California Cancer Registry and the California Behavioral Risk Factor Surveillance System. Late stage cancer web application was created using Esri ArcGIS. The CCR data analyzed was following National Cancer Institute's surveillance epidemiology and end results site recode ICD-3 2008 definition for colon and rectum cancer. And CCR and BRFSS data examined or present county level sociodemographic and cancer screening characteristics among adults with late stage diagnosed colorectal cancer. So if you will see when on the demo, but these were some of the highlights that hopefully you'll see for yourselves as you navigate through the web app. But close to 98,000 Californians over the age of 45 were diagnosed with colorectal cancer from 2016 to 2022 for an age-adjusted incidence rate of 89.6 per 100,000 people. Among these colorectal cancer cases, 56% were diagnosed at late stage, which underscores the need for enhanced early detection measures. Disparities in late stage colorectal cancer were seen across different counties, with Sierra and Yuba counties combined, Merced and Butte counties leading the way in terms of highest incidence rates. And among males and females, Merced County had the highest percentage among females, while Sierra and Yuba counties, again combined, held the highest percentage for late stage colorectal cancer diagnosis among males, each at about 62%. So finally, the conclusions from this analysis are that we can highlight the importance of using existing geospatial tools to combine data into one platform. The interactive web application provides a detailed visualization of late-stage diagnosed colorectal cancer in California, which helps health authorities with the necessary insights to improve early detection, timely diagnosis, and effective treatment strategies at the county level. And then this user-friendly resource can be used to identify and address cancer-related disparities, hopefully and ultimately contributing to better health outcomes within California. Okay, so I am going to get to the demo. Can everyone see this slide okay?
Yes.
Okay. All right. So the link will be provided to everyone. It is live right now, but this is the web application platform. As you look on the top across the navigation bar, you'll see these buttons that will take you down the page. Each of these control the page to go down, and you will see when we go further down, you can go back up to navigate through the page. It's kind of like a web application / report of things. Traditionally, just to give you a bit of background on the web application itself, this project mainly stemmed from a former project many years ago, but was originally created in PDF format, and it displayed static maps and accompanied data tables for each and every county, and they were originally posted to the CCR's webpage. And this took up a lot of bandwidth. It was a lot of work to do these individually, and so over time, it evolved into an interactive, more visually pleasing, navigable platform where also you can compare on across the different counties yourself without having to skip to other PDFs. And as well, you can download the data from this as well. So on this first introduction, this is basically static figures, but gives you the background, some of which I've already explained in the slide. And then it gives you if you click on this arrow here, you'll see the acknowledgments and disclaimer, which can also connect you to links outside of this application and go directly to California Cancer Registry and content privacy policies. As you click the next button, late stage colorectal cancer disparities, it'll take you down to another page. And then again, as you see across this navigation bar on top, it lists the different sociodemographics that we did the analysis on. The first page is obvious, is the overall California CR, colorectal cancer incidence rates across the state. The left-hand side gives you a quick summary of what's found on this page. And as you go to the next figure over, you'll see the map with a legend that looks at late-stage colorectal cancer incidence rate. You could click it out by hitting the X or keep it open. To the right of this, you'll see late-stage colorectal cancer incidence rate by county in descending order. You'll have the bar that compares the overall rate for California statewide. If you hover over each bar, you will see the county that as it appears with the rate listed next to that as well. The figure underneath the map gives you a little bit more information. It'll list the county seen. It defaults to alphabetical order, so Alameda is first. It will say the incidence rate, the overall count, the rate at late stage diagnosis, the count, and then the overall percent. If you click on anything, and it should interact. So if you hit, say here, Santa Cruz, this should highlight Santa Cruz on the map and will adjust for the information you see here on the feature info. You can clear the selection or clear the selection from here as well. These little 4 dots on the side of the figure are where you can download the data. I'm not going to download it here on this demonstration, but you will see when you hover over export, you can export to any of these formats, CSV, and it will produce the data that is on the figure that you have clicked for that information. So when, similar to the other, what I just displayed, you can look at the differences by sex. Same exact information. You can hover and it'll be in descending order. Same information given, but just for females. You have it for males. Same thing. Then you have it by race. And then you have, in this case, by age for under 50, then 50 to 64-year-olds, and then 65 years and older. At any time, also, you can, the left side gives a summary of what you see on the page, and you can also return to the top if you want to go to the main navigation index here. So the next section, when you have the sociodemographic and screening disparities, here you have a navigation bar with 3 different pages. You have on the left side another arrow that points to a summary of what is highlighted in these 4 figures to the right. At any time, you can also close this after reading. On this page, you will see the percent of late stage colorectal cancer diagnosis with the legend here and the map. To the right of this, you'll see the 5-year survival for late stage by percentage. You can expand this if you want it to with this little scroll bar. It's a little tiny. You can see that how that can open up a little bit. Here's the statewide 5-year survival rate compared to the different counties. Again, you can hover over and it will give you the 5-year survival for your county. On this graph to the this figure below the map, you will see the percent late stage diagnosis for colorectal cancer by payer source or insurance by the county, and you can hover over each bar and you'll see the type of insurance and the percent listed next to it. And on this figure, I believe at the bottom right, this is late stage colorectal cancer percentage by socioeconomic status tertile. Again, you can click on any of these. If you click on any county here and you hit on the map, it should highlight it and change accordingly. So here's Solano, there's Solano, and same here. This reflects Solano. If no information appears, it's because the data were suppressed, too small to display. And then again, similarly to the last page, the action button allows you to export. So you can, again, export this data based on this figure to an Excel spreadsheet or whatever format of your liking. The next page, if you click on CRC screening demographics, so this data was taken from the California BRFSS. Similar to the last page, you can click on this arrow, will give you a summary of some of the highlighted information taken from the BRFSS screening. On the bottom here is a little footnote on the actual screening recommendations at the time. You can click on select any of the counties, and again, these will change accordingly. You will have, this is a percent met the colorectal cancer screening guidelines, the USPSTF screening guidelines by SEC. You can hover over and see the actual percentage in that county. The 2 lines here represent the statewide percentage for males and for females. And then on this feature below the map, you have the percent of individuals that met the colorectal cancer screening guidelines by race, ethnicity, as well as additional information, the overall number screened by that county, the percent, standard error, and 95% confidence interval. You hover over each of these bars, you will see the race and the percentage by this county. Again, you can click and they should reflect in each of these differently. Here for Madera, as you can see, we don't have enough information for 2 of the racial categories. Again, you can also click to export the data on those 4 buttons. And then finally, we have the CRC screening health behaviors. Again, we have a little bit of summary information on the left, highlighting what is actually seen in this figure. This note points out some of the limitations to BRFSS data, and then here you have technical notes that show you some definitions of what these individual risk behaviors represent. And you have California in here as a kind of baseline comparison across California, what each of these percentages were in terms of health risk behaviors and disparities by each of the individual counties. And here you can also download the data for each of these risk behaviors as well. And finally, we just have, for more information, there are some of these tools that are already in existence. And you can also send this to yourself. You can take the link and send it to other folks or post it on Facebook, text, however way. One of the other things I wanted to point out was, in addition to the main objectives that we listed on the previous slide, this web app was also designed to complement existing data visualization products that already host CCR data, such as, if you don't know, Cal Explorer and California Health Maps, which are here. These are also great visualization tools, but in this case, individual county incidence rates and percentages for late stage diagnosed screen preventable cancers were not present on these other tools. So this tool was hoped to, mainly complement that, in addition to hopefully help counties be able to meet their objectives and maybe enhance screening for colorectal cancer in their counties. The other thing I wanted to mention, let me stop sharing, is that we hope to, this one is focused on colorectal cancer, but we hope to do the same for the other screen preventable cancers, including breast, cervical, prostate, lung, and oral cavity and pharyngeal cancers. So that is it. And I'm happy to take any questions or feedback.
Thank you so much, Vanessa, for your presentation and the web map application demonstration. Truly appreciated. So at this time, I'd like to open the floor for any questions or comments. I'd like to read off some questions and comments of the chat that we've already received. Dr. Anderson, Stoney, this is very informative and needed overview of CRC. Thanks so much. And then he also asked, can we export the data to a PowerPoint? And when will you use the BRFSS 2024 screening data?
Yeah, so I'm not sure if that can be exported to a PowerPoint. I haven't figured that one out yet. But in terms of 2024 screening, that's what I'm using right now, analyzing this data. What I'm hoping to do is incorporate all of the screen preventable cancers into one web application, so that what I was saying earlier would include breast, lung, oral and pharyngeal, prostate, and cervical all into one. So it would be where you would be able to navigate through each of the different cancers. 2024 BRFSS cancer does include colorectal cancer. But some of the limitations with that, they BRFSS themselves have changed some of their way of including them on the core questions. So we might be limited. I still have to take a look to see if there is enough data to support the other screen preventable cancers like cervical, lung, and prostate. I know those were recently introduced or changed over the years, but they'll definitely include the colorectal cancer and breast for sure in the coming iteration. I'm working on that right now, so those should be coming out soon.
Thank you, Vanessa. We also received a question from James Moo. Is there a significant difference in the utilization rates for CRC screenings in those regions, counties, colonoscopy, Cologuard?
I didn't look at them separately for this analysis. The USPSTF recommendations were just essentially meeting at least one of those. It does talk about that on the page that I described in the footnotes is what was defined as having met each or one of the methods listed. But we can provide separate if we would reach out and ask for separate observations in terms of the specific method. We can I can always take a look at those separately if you have a request.
Go ahead, Stoney.
I would doubt that good data on that would be available with the size of the survey of the behavioral risk factor survey in 2024 to get down to that level of detail. There are a few articles on that, and a few articles we know that the fecal DNA is increasing because of very aggressive marketing and also the fact that they do navigation to get the test back.
Yeah, the questions on the methods, the different methods have changed on the BRFSS to accommodate the changes in the screening tests themselves. So as far as looking at 2024 individualized, I mean the data are weighted, but and the age group screening has also changed. I think it started in 2020, I believe, when they started interviewing folks that were 45 and older when the guidelines changed from 50 as the screening age.
Go ahead, Lisa.
Yeah, I had a question about the risk factors that these young colon cancers or colorectal cancers patients have. Are there any commonalities within this group? How do they do? What's the survival rate for these?
Well, that's interesting. I didn't look at that, but I did do a analysis before, just comparing, those over 50 versus those under 50, just in terms of incidence for colorectal cancer and survival. I did not look at the risk factors associated because they don't, in this case, BRFSS data do not ask, they don't even ask questions of anyone under 45 now in regards to colorectal cancer screening. So I could look at the risk factors for those under that age, but then I don't know whether or not they've actually screened for colorectal.
Thank you.
Thank you, Lisa. Do we have other questions? We have a follow-up questions from James. Are there similar data outside of California, USA?
As far as I know, you can look at overall incidence for colorectal cancer. Like I said, in California, we have a couple of other tools, CalExplorer and California Health Maps. And California Health Maps looks at incidence. You can't really find late stage statistics by county. You can find overall incidence by county on those tools, but not by late stage type.
Thanks, Vanessa. I'll also read off some questions that were prepared. Are there small numbers suppression or data privacy rules applied at the county level in this web application, and how do they affect what viewers see?
Yes, so we follow the California Health and Human Services guidelines for de-identification. So the counties with denominators or case counts less than 11 are usually suppressed. And so we also combined some of the smaller counties. Historically, we've done this before the counties are known to be like, as they are contiguous counties with similar information. So we tried to maximize that so that we can display more information. But as you'll see as you navigate through the maps yourself, that some of them will be suppressed.
Thanks, Vanessa. We also received a comment from Debbie. We are working to expand California health maps to include percent late stage. California health maps also includes data for sub-county zones. We have another question. Is there a rise in CRC early or late in Europe as well?
In Europe, you don't know that one. I haven't taken a look at that. I'm sorry.
No worries. I also have another question here. You might have already answered it, but could you remind us how frequently will the web map application be updated, and what's the typical lag between CCR case reporting and display in the web app?
So, this map only shows up to 2022, so it's about a 2-year lag. The BRFSS data are only asking cancer screening questions on alternate years in the even numbered years. So when it coincides together, I'll probably be releasing this towards the end of the year, and it will just encompass through 2024. The data for CCR are not even released yet for 2024. So it might be kind of offset. BRFSS data, screening data will be available through 2024, and the CCR data through 2023, but probably released at the end of 2026. So yeah, it's basically going to be based on what's available at the time and how quickly it can be produced and then published.
Thanks, Vanessa. And then I guess another question would be, for everyone using the web application for the first time, what feedback would be most useful from users, such as think about features, indicators, or technical support that could improve the next release?
Yes, definitely. I appreciate anything that you find that's anything glitchy, what might help improve the look as well. We're open to anything.
Thanks. Trying to scroll through if we have any other comments received. Lisa also said that this presentation contains important material that I would like to use in teaching medical students. Appreciate that, Lisa. I guess we can pull out our slide deck back up, Joyce. Looks like we don't have any more questions at this time. So I'll go ahead and wrap up with a little early and advance to this slide. Thank you again, Vanessa, for such valuable insights you shared with us today. Please take a moment to complete the short webinar evaluation that my colleague Joyce had shared in the chat. So our next webinar is on May 19th, where we will hear from our presenter at UCD CalCares. So the recording and slide deck will be shared with you via email. Again, thank you all so much for joining us today. Please let us know if you have any questions. Thanks, everyone.